Health insurance is expensive. Medicaid has strict income limits, and private insurance? Forget it. It can cost more than rent. If you're stuck in the middle trying to figure out how to get healthcare for your child, I have some good news for you. There's a program called CHIP, the Children's Health Insurance Program, that helps families who earn too much for Medicaid but still can't afford private insurance. CHIP covers doctor's visits, prescriptions, hospital stays, dental care, vision, and even mental health services. In some states, it even covers pregnant women. And the best part is that it's either free or very low cost, depending on your income. If you've ever worried about taking your child to the doctor because of the bill, this could be an answer for you. So how do you know if you qualify? What does CHIP cover? And how do you apply? Let's break it down so that your child can get the care that they need. CHIP is made for kids between birth and age 19 who live in families that make too much for Medicaid but still struggle to afford private insurance. Every state sets its own rules, but in most cases, if your family earns between 200 and 300% of the federal poverty level, your child may still qualify. That's roughly $60,000 to $90,000 per year for a family of 4. Now, even if you've been denied Medicaid, your child may still qualify for CHIP. It's worth checking out because some states even let families with slightly higher incomes buy into CHIP at a reduced cost. So even if you're over the income limit, there may still be options for you. So, would you be interested in a state-by-state breakdown of CHIP eligibility? Let me know in the comments. And now let's talk about what CHIP actually covers. This program is designed to make sure that kids get the care that they need without stressing families over the cost. CHIP covers regular doctor's visits, checkups, routine vaccinations, prescriptions, hospital stays, emergency care, dental visits, vision care, mental health treatment, and even things like physical therapy. There are no deductibles, and copays are very low, sometimes even free depending on your income. That means no more worrying about how you're going to afford your next checkup or what happens if they break a tooth, right? But here's something important to know. Every state runs CHIP a little differently. Those income limits, the costs, and the coverage details can vary. So to get the exact details for your state, visit your state's Medicaid website or call Insure Kids Now hotline at 1-877-KIDS-NOW. They'll connect you with the right program in your area. So, do you think CHIP should have the same benefits in every state? Drop a comment and let us know what you think. And now let's talk about the cost. Good news is that CHIP is very affordable. Many kids qualify for free coverage, especially if their family's income is on the lower end of the eligibility range. If your family earns a little more, you may have to pay a little more, but it's still usually under $50 a child. And copays for doctor's visits are usually just a few dollars or nothing at all. So here's an important fact that a lot of people don't know. CHIP will never cost more than 5% of your family's yearly income. That means that no matter what, this program will always be a cheaper option than private insurance for you. And if your family truly can't afford to pay, it says that no child will ever be denied CHIP coverage because of the cost, and that is a big deal. Most parents want to know if they can keep their current doctor. The answer is probably. Most doctors who accept Medicaid also take CHIP. In fact, about 70% of doctors in the U.S. now accept Medicaid and CHIP patients. But some providers will limit the number of CHIP patients they take, so it's always a good idea to check ahead of time. Once your child is approved, you'll get an enrollment card in the mail. There's a phone number on the back that you can call for help finding doctors and specialists near you who will accept your benefits. One of the best things about CHIP is that you can apply anytime. There's no open enrollment period, so you don't have to wait. You can apply online at healthcare.gov, by phone at 1-800-318-2596, or in person at a local health clinic or through your state's Medicaid office. The application process is simple, and approval usually only takes a few weeks. Some states even offer temporary coverage if your child needs medical care right away, so that you don't have to wait if your child needs help now. Now, I know a lot of parents have questions about CHIP, so I want to clear up a few common ones. Can you get CHIP if you already have private insurance? Maybe. Some states allow CHIP to supplement private insurance if your current plan doesn't cover essential services. Does CHIP cover dental and vision? Yes. In most states, it includes checkups, glasses, dental care, and so on. What happens if your income changes? If your income goes up, your child might move from CHIP to a different insurance program, but of course, you'll be notified before those changes happen. Can legal immigrants get CHIP? Yes, but the rules vary by state. Many states offer CHIP to lawfully residing children and pregnant women without a waiting period. Do you have a question about CHIP? Drop it in the comments and we'll do our best to answer. If you've been stressing about how to get your child's healthcare covered, please check this program out. It's a lifeline for families who can't afford private healthcare options. There's no penalty for checking, and it could make the difference between your child getting the care they need and going without. So if you found this helpful, check out our other videos for more ways to save money and get free stuff.